So welcome to the session on median nerve. The median nerve is, to understand the median nerve, I would request you to please refer to the previous video on my channel, which is on the muscles of the forearm. Okay. Now, median nerve is the nerve, main nerve of the anterior compartment. I'm talking about the introduction, anterior compartment of forearm. And these forearm muscles are very much prominent. Anterior compartment muscles of the forearm are very prominent in the laborers, and therefore this nerve is called as the laborer's nerve. Okay, it's called as the laborer's nerve. Okay, the laborer's nerve. With that introduction, let's go to the origin of this nerve. From where does this nerve origin? It is or origin, or rather I would use the word formation. Okay, formation. It is formed by the union of lateral root of median, which comes from the lateral cord, and medial root of median, which comes from the medial cord. Okay. So again, going to the brachial plexus, C5, C6, C7, C8, T1. These are the roots. Okay. The roots combine to form trunks. Upper trunk, middle trunk, lower trunk. Okay. They divide into anterior, posterior divisions. Okay. The anterior and posterior division. Anterior divisions unite here of the upper and middle trunk to form the lateral cord. They form the lateral cord. It has a root value C5, C6, and C7. And this anterior division of the lower trunk, it continues as medial cord. So most of the branches will have C8 and T1 because it is coming from C8 and T1. And the formula for this is M for U, medial. Okay. And of this, one M is medial root of median, one of the branch. Medial root of median, which has a root value of C8 T1. Branches of lateral cord is LML, lateral cutaneous, musculocutaneous, and the other branch is lateral root of median. So the medial root of median and lateral root of median, they together they unite and they form the median nerve. Okay, so this is how median nerve is formed. By medial root of median coming from the medial cord and the lateral root of median coming from the lateral cord. This has a root value of C5, C6, C7. This has a root value of C8, and therefore the root value of the median nerve will be C5, C6, C7, C8, and T1. All of it is coming from the anterior division, and therefore this nerve will supply the flexors. While the radial nerve, which is formed by the union of the posterior divisions of all the three cords, it will also have C5, C6, C7, similar root value as the median nerve. The radial nerve will also have, but it is all coming from the posterior division, and therefore radial nerve will supply the extensors. Posterior division supply the extensors, and anterior divisions will supply the flexors. Okay. Now let us go to the force and relations. Force and relation of this nerve. The nerve starts from axilla. Okay. Now starts from axilla in the lower part of the axilla. It starts from the lower part of axilla. After it is formed in the lower part of the axilla, it passes to the arm or brachia. In the brachium, one of the major things what it does is it crosses the brachial artery from lateral to medial side. Then this nerve is seen in the cubital fossa as the medial most structure. It appears in the cubital fossa as medial most structure. Medial most structure. Then it enters the forearm. It enters forearm. And in the forearm, it will supply majority of the muscles. It will supply the majority of muscles. And then it passes, it enters the forearm, and then it passes in the hand. It passes in the hand by crossing the crossing below the flexor retinaculum. This flexor retinaculum, it passes below the flexor retinaculum. So passes below the flexor retinaculum. Okay, and this is also called as carpal tunnel. Carpal tunnel. Okay, passes below the flexor retinaculum, which is also called as carpal tunnel, and then enters the hand. It enters the hand and supplies some muscles in the hand over here. Now let us study the relations. Let us study the relations. In the lower part of the axilla, it is in close relation with the third part of the axillary artery. So we again draw our diagram. Pectoralis major anteriorly, the subscapularis latissimus dorsi and teres major latissimus dorsi posteriorly. Here is the axillary artery. Okay, this is the lateral side, this is the medial side. Okay, on the medial side, always throughout the axillary artery is axillary vein. On the lateral side is the coracobrachialis muscle. Okay, so this nerve, median nerve, will be here laterally. Median nerve, posteriorly will be radial nerve. Okay, and here will be medially will be ulnar nerve. Okay, so the median nerve will be located between the axillary artery and the, and also here will be the musculocutaneous nerve, which will be piercing the coracobrachialis and going like this. The musculocutaneous nerve, but median nerve will be here. Okay, so that will be the relations in the axilla. Okay, in the arm, you don't have to show too many relations. The brachial artery is running like this. Okay, and the median nerve crosses the brachial artery from lateral to median side. So this is brachial artery and this is median nerve, crossing it from lateral to medial side. Then we show the cubital fossa. In the cubital fossa medially is pronator teres, right? Laterally is coracobrachialis, brachioradialis, sorry. And there are four structures. The median nerve is the most medial. I'm maintaining the medial side and lateral side. Okay, after median nerve is the brachial artery, and then the next is the biceps brachii tendon. Biceps brachii tendon, and the lateral most structure is the radial nerve. Lateral most structure is the radial nerve. So this one more diagram. So diagram 1, diagram 2, diagram 3. Okay. Now it enters the forearm. In the forearm, it lies between the flexor digitorum superficialis, and flexor digitorum profundus. Okay, it lies between the flexor digitorum superficialis and flexor digitorum profundus. And in the lower part of the forearm, suppose this is the flexor digitorum profundus, then this is the flexor digitorum superficialis, this is flexor carpi radialis, and this is palmaris longus. So the nerve lies in between. The median nerve is here. Median nerve is here. On its medial side, it flexor digitorum superficialis. On its lateral side is flexor carpi radialis. On its anterior side is palmaris longus. On its posterior side is flexor digitorum profundus. Okay, and then it enters the hand. Now let us see the muscles. Let us see the muscles supplied by the median nerve. In the arm, it does not supply any muscle. Okay, no muscle supplied. Okay. Now here, for convenience sake, in the forearm, I am writing this as deep compartment and this as anterior compartment or superficial compartment. Deep compartment and superficial compartment. In the superficial compartment, all of us know that there are 5 muscles. Of these 5 muscles, 4 muscles are supplied by the median nerve. So when we studied the cubital fossa, we said median nerve is there, medial most structure, and actually it leaves cubital fossa. It leaves cubital fossa by passing between 2 heads. By passing between 2 heads of pronator teres. So it supplies pronator teres. Okay, and just write the whole thing. It supplies pronator teres. It supplies flexor carpi radialis. It supplies palmaris longus, and it supplies flexor digitorum superficialis. So I can say that it supplies all the muscles, superficial of the 5 muscles. It supplies the 4 muscles. It supplies all the muscles in the superficial compartment of the anterior of forearm, except for flexor carpi ulnaris. There are 5 muscles over there: pronator teres, flexor carpi radialis, palmaris longus, flexor digitorum superficialis, and flexor carpi ulnaris. So flexor carpi ulnaris is not supplied by median nerve. Remaining 4 muscles are supplied by the median nerve. Of the deep muscles, it supplies flexor pollicis longus, and it supplies the lateral half of flexor digitorum profundus. Lateral half of flexor digitorum profundus. That means profundus is going to split into 4 tendons. So these 2 tendons, the lateral 2 tendons for the index finger and the middle finger, will be supplied by the median. It supplies the pronator quadratus muscle. Pronator quadratus muscle. Okay, so it supplies 4 muscles on this side and 2.5 muscles in the deep compartment. These 2.5 muscles in the deep compartment are supplied by its special branch, not directly, by its special branch called as anterior interosseous nerve. Anterior interosseous nerve. So it gives a branch called as anterior interosseous nerve, which supplies the 2.5 muscles in the deep compartment of. Okay. Now it goes and below the carpal tunnel and goes into the hand. In the hand, it supplies muscles, 2.5 muscles of the thenar eminence. 2.5 muscles of the thenar eminence. What are those 2.5 muscles? Okay. One, it supplies abductor pollicis brevis. It supplies abductor pollicis. It supplies opponens pollicis. And it supplies the superficial head of flexor pollicis brevis. So 1.5 superficial head. So 2.5 muscles. And then it supplies the skin. So it has muscular branches, and it has a in the hand it supplies 2.5 muscles of the thenar eminence, abductor pollicis brevis, opponens pollicis, and superficial head of flexor pollicis brevis. And in as regards the skin is concerned, suppose this is the thumb, and then this is the This is the middle finger, and then this is the ring finger, and this is the little finger. So the median nerve goes here and gives branches. It will give branches. These are the branches for the cutaneous supply. Okay. These are the branches for the cutaneous supply. So it is supplying 1, 2, 3 and half. Of the ring finger, it is supplying only half. So remaining 1.5 will be ulnar nerve. So this is little finger, this is thumb. This is the lateral side, and this medial side. Okay, and this is the lateral side. Okay, so this is thumb. Okay, so it supplies, regards the skin, it supplies lateral 3.5 digits. Lateral 3.5 digits of the as regards the cutaneous supply is concerned. It supplies lateral 3.5 digits, and it also supplies lateral 3.5 nail beds. It supplies lateral 3.5 nail beds. So as regards the supply in the hand is concerned, more of cutaneous. It supplies the thumb, skin on the thumb. Of course, I am talking about the palmar aspect, the skin on palmar aspect. Skin on palmar aspect. It supplies the skin of the thumb, skin of the index finger, skin of the middle finger, and the lateral half of the ring finger, medial half. So 1, 2, 3, 3.5. 3.5 is the supply. So again, before we move on to the applied anatomy, we'll just discuss the median nerve again. We said it is the nerve of the anterior compartment of forearm, called as laborer's nerve. Its origin is formed by the union of lateral root of median and medial root of median, and the median nerve is formed with the root value of C5, C6, C7 clear. Starts in the axilla lower part, where it is lateral to the axillary artery. It is lateral to the axillary artery, and medial to the coracobrachialis muscle, posterior to pectoralis major, and anterior to teres major. It crosses in the arm. It crosses the brachial artery from lateral to medial side and goes to the cubital fossa, where it is a medial most structure. So we draw that, and then it leaves the cubital fossa by passing between the two heads of pronator teres and lies between flexor digitorum superficius and profundus in the major upper part of the forearm. So this relation is in the upper forearm, and in the lower forearm. In the lower forearm, it lies lateral to the flexor digitorum superficialis. Okay. This is flexor digitorum superficialis, and medial to flexor carpi radialis, anterior to flexor digitorum profundus, and posterior to flexor pollicis longus. So its anterior relation is palmaris longus. Its lateral relation is flexor carpi radialis. Its medial relation is flexor digitorum superficial, and its posterior relation is flexor digitorum profundus. After that, it crosses the flexor retinaculum or the carpal tunnel, goes to the hand and gives muscular and cutaneous branches. Cutaneous branches are for the lateral 3.5 digits and also lateral 3.5 nail beds. The muscular branches are 2.5 muscles: abductor pollicis brevis, opponens pollicis, and the superficial head of flexor pollicis brevis. As regards the applied anatomy is concerned, the one major thing about the applied anatomy you should know is carpal tunnel syndrome. Carpal tunnel syndrome. We studied that this passes through the carpal tunnel. Because it is passing through the carpal tunnel, any inflammation in this carpal tunnel due to fracture, due to pregnancy, due to renal damage, the nerve can get compressed, and then the thenar muscles are wasted. Okay, the thenar muscles are they get wasted. Now we know that it supplies these muscles called as abductor pollicis, there is opponens pollicis. So once it is damaged, the patient, if you tell him to do the opposition, so patient will not be able to do this movement of opposition. Also, because now the median nerve is damaged, the grip is lost, because it is the muscle which is supplying this. Opposition is needed. Okay, opposition is needed for the grip. So opposition is lost, so the grip is lost. Rather, the thumb comes to lie on the side like this, and that is called as, in the what is classically a ape thumb deformity. And then there is a pen test. Okay, you tell put the patient like this and tell him to touch the pen. The patient will not be able to lift the thumb. Okay, so we do the pen test for testing the median nerve. So carpal tunnel syndrome, very important. When the median nerve, when it is passing through the carpal tunnel below the flexor retinaculum, can get compressed in case of pregnancy, in case of fluid accumulation, in case of fracture of the wrist, in case of any inflammation near the wrist. And then the supply of the cutaneous supply of the lateral 3.5 digits of the hand is lost, and the uh, muscles of the thenar eminence get wasted. There is ape thumb deformity. There is no opposition movement possible. Because of that, the grip becomes grip, tight grip to hold things is lost. And pen test, if you try to check, the person is not able to lift the pen because the thumb is lying by the side with the other fingers, which is called as ape thumb deformity. With that, we stop our session on the median nerve. Thank you so much.